You're up next.
Thank you, Mr. Chairman. Must be high noon. So thank you for holding this hearing. We have in my home state of South Dakota lots of challenges in accessing health care services in rural areas, and we have providers who work diligently coming up with creative solutions, but there are still barriers and complications that they face on a daily basis. Part of it has to do with traveling long distance and having limited transportation options. There are big hurdles for people to overcome. And attracting providers, of course, to rural areas is another challenge that we face. Too often we lose South Dakotans if they attend school and train in other states. And we've got a unique issue in South Dakota as well with our tribal communities, making sure that they have access to quality health care services due to the pervasive problems that Indian Health Service facilities throughout the Great Plains region continue to have. So I look forward to working with my colleagues on this committee and trying to advance solutions that will address many of these challenges. Dr. Mueller, in your written testimony, you mentioned that Rupri Center has completed multiple studies on how telehealth can serve as a tool to expand access to care in rural settings, and I couldn't agree more. I understand that you have a current project that's looking at Avera Health's e-care initiatives in South Dakota, which range from emergency department, e-ICU, e-pharmacy, e-behavioral health, and more. I've seen some of this technology firsthand and know they're working hard to innovate. From, I should say, for this committee's benefit, could you discuss what you've learned so far about Avera's model and how it's helped increase access in our state of South Dakota?
Well, thank you, Senator Thune, for the question. I'll focus primarily on what we've learned about the use of telehealth in the emergency rooms because that has impressed us the most. What that has done, especially since I mentioned earlier CMS conditions of participation, a condition of participation was changed a number of years ago to allow meeting the necessity for an on-call physician through the use of telehealth. And that has made a tremendous difference across South Dakota and other facilities that Avera supports because you can have an advanced practice primary care provider, not a physician, in the ER that can quickly access a board-certified physician. But more important even than that is the finding that the use of that kind of telehealth actually helps in recruitment and retention of primary care providers. And this goes to a broader point that the more we can do to support the professional activity of those healthcare professionals in the local environment, the greater the likelihood they'll come there because that's how they want to practice with the support of board-certified physicians, and the greater likelihood they'll stay because they're getting that kind of consultative support. The other quick example is in the case of pharmaceutical services. Inside the hospital in particular, which is how the eHealth suite from Avera reaches out, you can meet the requirements for review of medication as it's being prescribed in the hospital much more efficiently and effectively through the use of telehealth.
We've perhaps, as you know, put forward multiple policies that were signed into law this year that will reduce barriers to the use of technology in Medicare and promote telehealth and Medicare Advantage in accountable care organizations and other areas, including in treating stroke patients. And these are significant advancements, but I'm wondering if there are other areas where technology can transform delivery of care in rural states. I mean, what should we be looking for in terms of technology opportunities in Medicare and Medicaid from your perspective? And if Ms. Thompson, if you would care to comment on that as well. But we're making some headway. What else should we be doing?
I think we should try to learn as rapidly as we can from, you mentioned the use of telehealth in ACOs and Medicare Advantage plans so that we can transfer that knowledge into the basic Medicare system and affect reimbursement policy, as was mentioned earlier this morning, as one of the barriers to the expansion of telehealth.
Ms. Thompson.
And I would simply add, I think there's a great opportunity to attract the new generation of physician providers or providers in general to rural health. These young people have grown up with technology. It's very familiar to them. And frankly, it gives them a lifestyle that is something that is very attractive and I think would help us answer the needs of recruiting to the rural areas.
Okay. Mr. Chairman, I have another question I can submit for the record having to do with EHRs and how that impacts service delivery in rural areas as well, but so my time has expired, so I'll submit that for the record.